Hello, I'm Andrew Valensoen. This is the second video I've done for MedLearn. The first one, a little while ago now, I was trying to promote the concept of measuring patient-reported outcome, i.e. measurement of outcome beyond death, showing the benefit that we gain from treatment given particularly in our hospitals. Our recent Secretary of State, Jeremy Hunt, had a passion for safety and measurements around that, particularly more recently to measure avoidable deaths, for instance. And I have great respect for that. First do no harm is a major dictum for the clinical professions, of course. But as I said to him, patients don't just come into hospital to be safe and go home thinking, oh, at least I was safe. They come in to have relief of pain and suffering, to improve their quality of life and to improve their health. And it's strange that we don't routinely measure that part of it. We measure if they die, but we have to move on from just dead or alive and measure how well we do if they don't die. And this is where the whole work of patient-reported outcomes comes in. I was very involved in, first of all, working with routine collection of patient-reported outcome measures back in the 90s when I was working at Bupa hospitals. And then we moved on to the national programme, the National Health Service national programme, which I was very involved in, and which was lauded as one of the first routine collection of patient-reported outcome programmes in the world. Sadly, though, now that programme seems to have come to a sort of plateau. In fact, 2 of the 4 PROMs that we piloted at that time have now been taken out, and it doesn't look like there are any more coming. And sadly, then, as a result, the rest of the world, particularly the United States, is now sort of taking a lead on this, and there's a lot of work on collecting outcomes beyond death around the world, but we're a bit stagnant here. However, thanks to the Competition and Markets Authority, the Competition Commission in this country, we are now collecting patient-reported outcomes in the private sector. In 2014, they mandated all private hospitals, private clinics, NHS pay-bed units, cosmetic surgery clinics, to collect data in a standardised way, 11 data sets actually, and submit that to the information organisation they'd chosen, PHIN, the Private Healthcare Information Network, which I happen to chair. And so we, as part of one of those data sets, we are going to be collecting patient-reported outcome measures. And so we will now have a national programme, and it won't be long before we will be turning that data that we're collecting from all those hospitals into information on our website to help patients make better informed choices about the treatment or the places they can go and the doctors they can go to, because we're also collecting data on consultants as well, where the volumes are high enough to have valid measures. So I think that's great news, and thank you very much to MedLearn for allowing me to update my last video and tell them about the progress with the collection of routine patient-reported outcome measures.